The posterior chain is a collection of interconnected muscles and the overlying tissue called fascia that connect the feet to the head. They can start from the plantar fascia, the bottom of the feet, go up through the calf muscles, hamstrings, into the gluteus maximus, up the spinal muscles, into the back of the head. Two other muscles, the diaphragm and the latissimus dorsi, also play a critical role in influencing the function of the posterior chain, which helps with all spinal movements. This set of sequences helps encourage posterior chain mobility throughout the entire spine. We start off with a tennis ball or any other ball that has some type of compressibility but has firmness. And you spend a minute massaging the foot back and forth. After that minute, you drop the heel, stretch the calf, and take one hand and stretch the upper part of the neck. Just pull the head forward to the point of mild discomfort and a slight stretch, and hold that for another minute, and then we repeat to the other side. Here I demonstrate it from a different angle. I do recommend 1 minute on each foot and 1 minute for each stretch, for a total of at least 4 minutes. Next we move on to the latissimus dorsi muscle. This attaches to the upper arm and extends all the way down to the low back. You're going to place your palms and the forearms on a counter or a table, then slowly walk backwards till you get to the point where your back is pretty flat. Then you start bending your knees up and down. It is important to try to get your feet as far back as possible, but keep half your forearm and your palms on the table. I'll demonstrate it one more time. Remember, you want to keep your palms and at least half your forearm on the table and step back as far as you can and try to get your back as flat as possible. I like bending the knees as it's like flossing the tissues, allowing to stretch and relax, stretch, relax. But you can also find benefit holding it for about a minute or two. Next we proceed to the diaphragm stretch. While you're sitting comfortably in a chair, take your fingers and gently curl them underneath your ribs, pressing upwards to get a little bit of a stretch underneath the ribs, but not to the point of discomfort or difficulty breathing. I recommend 10 breaths into the fingers at least. Finally, we do thoracic mobility, leaning backwards against the back of the chair. If you can't get your hands over your head, use your hands against your lap and gently push backwards. And here I demonstrate it from a different angle. 10 breaths into the diaphragms, and then for the leaning backwards over the chair, 10 back and forths, and then hold that backward stretch for a minute. While you are becoming familiar with this sequence, pause the video to practice each activity. Eventually, you will not need this video in order to do this sequence. The approach to these mobility sequences is to demonstrate activities that can be done throughout the day. The more you can find ways to incorporate this sequence into your daily life, the more benefit you will find. Fitness is a daily lifestyle that can be improved with small steps throughout the day.